Welcome, everyone. I'm Regina with Princeton Integrative Health. I'm so grateful to have Caitlyn, our patient, here tonight to share her journey in the medical marijuana program. Caitlyn, if you could give a little background information about yourself, where you're from, what you're studying.
Of course. Hi, my name is Caitlin. I currently reside in Princeton, so I'm very, very close. I'm local. And I am currently in my senior year of college studying music education.
Amazing. And what school are you attending?
I go to Moravian in Bethlehem, Pennsylvania.
Awesome. So I just want to kick off this discussion. So
Mhm.
I'm the cannabis educator and community educator at Princeton Integrative Health. We're located in Lawrenceville, New Jersey, and we are an enrollment center into the medical marijuana program. Dr. Leonti, he's a physician in New Jersey and Pennsylvania, and Caitlyn is a patient of ours. Caitlyn, ask you a couple questions about your journey. What was life like before you started the medical marijuana program? What started you on using cannabis plant medicine?
I use medical marijuana for my mental and physical health. I've had terrible anxiety for pretty much as long as I can remember. My family, of course, being attentive parents, they picked up on it before I even knew what I was doing. Of course, when I was a child, they said I had very anxious tendencies. It was more than just being a little apprehensive to go on the slide. I was always just fearful and self-aware. And now that I look back, I definitely see them being right for one, and then looking back on the things that I was feeling and how that affected where I am today. I didn't actually start seeking out psychiatric help until my freshman year of college, when things really started to feel like they were getting out of control. I was always a pretty good student. I tried my hardest, but there was always that sort of disconnect, and it was very discouraging, on top of always feeling the stress and the common symptoms of anxiety. So you might know from DSM that there's your head spinning, you constantly feel dizzy, you feel like you're dissociating. For me, it was mostly dissociating, feeling dizzy, tired. My appetite significantly changed. Like, I've never lost so much weight because I was just like not hungry in college, and I didn't have to worry about the freshman 15. But it got really scary because I felt like I was really starting to lose myself. And I was reflecting on all my previous experiences in elementary, middle, and high school. It didn't help that I didn't have the best educational experiences, though I tried my hardest. And of course, college is all about experimentations and everything. And I experimented with cannabis once, and I thought, wow, this is actually really, really nice. I knew what I was using at the time, and of course, I wasn't like using it. I was technically using it recreationally, but then after that, I realized that maybe there's a way that I can actually like use this legally and medicinally. And when I got to my sophomore year, spring semester, I was working with a psychiatrist who really wasn't helping me. She prescribed Klonopin and Xanax at the same time, along with hydroxyzine, which is another anti-anxiety medication that makes you feel really, really drowsy and really out of it. I was on Zoloft, another one, Atarax, Buspar. I was pretty much taking almost everything under the book, and it was sort of feeling like that was becoming like a different med of the week sort of thing. And that was incredibly discouraging to my family and I. I felt like I wasn't getting anywhere. They didn't feel like I was getting anywhere. I was just slapping on that happy face and pretending that everything was okay, but everything definitely did not feel okay. So last year, I began my medicinal cannabis journey with the help of Lisa and Regina and Dr. Leonti. And I can definitely say that from that experience, I have definitely benefited so much from it. As a struggling student, I've gone from a 2.6 to a 2.93 GPA. So I've definitely seen the help,
Oh,
the
I was,
resolve in my symptoms.
that was amazing.
It was, yeah, it was hard because I was at a 3.0 freshman year, and I dropped all the way down from fall semester, sophomore year, to like a 2.6. And that was incredibly discouraging. I was contemplating having to adjust my major. I'm music education, but education requires you to have a 3.0. So I would have to switch to music performance or music BA, which my family was not the most okay with, because their idea of music is, well, if you're studying you're in college to become a music teacher, and I'm like, yes, but I can do that with a performance degree, but it was just a whole entire mess. And just being able to find something that is natural and herbal to help me cope with my anxiety symptoms, and over time with therapeutic cognitive therapy, I was able to really help myself in ways that I don't think I could have helped myself. Like, I look back on Caitlyn from freshman year, freshman summer, and I see someone who I don't even recognize her. I feel like she was just so lost, and she didn't know what was going on, and she didn't know this existed at the time, but I definitely feel transformed for the better.
And I mean, that's such a beautiful story. And so many people, especially now during these unprecedented times,
Oh,
are
yes.
experiencing stress and anxiety. So it just resonates with myself, and I'm sure anyone that listens, that this, especially when you're in school, that focus is so important. But when you're living inside your head, it's extremely hard to fine tune your thoughts. So and I'm a medical marijuana patient myself, and I was also I am a patient of Dr. Leonti's, and I was on a bunch of different medications for hormone imbalance that I didn't need to be on. But with plant medicine and cannabis, I was able to manage my pain. So that really resonates with me. The fact that you started your journey with pharmaceuticals. Not to say that they're bad, but
No.
why do they have to be the first resort when you can find something more natural? Another question that pops up, and I know a lot of other patients that are listening that say, I have anxiety, maybe cannabis could work for me. So, being a patient, you're a patient, it's not a one size fits all. There's a
No.
trial and error period, right?
Just
Uh,
like any other medication.
so as a patient with anxiety, a college student with anxiety, what does your routine look like? What works for you?
And there's a lot of really, really, really great, I guess, cannabis connoisseurs at the dispensaries that are really, really great at educating you as far as how the strains affect you, and different balances of them. Because some of them are more CBD dominant, so that would be awesome for someone that's looking for more pain relief, maybe from their arthritis or back pain or whatever. Whereas some of them are more THC dominant. So they might help someone with like really, really extreme anxiety, or maybe not help someone with extreme anxiety. So it's always really great to talk with those people, and it's usually at no extra cost too. So that's also awesome.